1. Kennedy's vaccine crisis, legal battles, outbreaks, and future scenarios. 2. RFK Jr.'s Gavi decision, how withdrawing funding puts millions of children at risk. 3. New CDC vaccine panel members' controversial anti-vax past. 4. RFK Jr.'s Gavi funding cut, the controversial vaccine study behind the decision. 1. Kennedy's vaccine crisis, legal battles, outbreaks, and future scenarios. Vaccine shortages, viral outbreaks, widespread illness, increased mortality. Imagine a world where, by September 2026, routine childhood vaccinations in the United States have become optional. In this unsettling scenario, government officials have hastily compiled a vast registry of individuals with autism and have controversially classified this neurodevelopmental condition as a compensable vaccine injury. This decision has opened the floodgates for a wave of lawsuits against vaccine manufacturers. As a result, some companies have completely withdrawn their vaccines from the domestic market due to dwindling demand and rising legal challenges. Consequently, outbreaks of preventable diseases are sweeping across the nation, affecting tens of thousands and leading to tragic fatalities, particularly among vulnerable groups such as children, pregnant individuals, and the elderly. Alarmingly, a similar situation is unfolding globally, as the U.S. government has ceased vaccinations for millions of children worldwide. This grim scenario is one of the potential futures America could face if we continue to follow the path laid out by Robert F. Kennedy Jr. and other anti-vaccine activists within the Department of Health and Human Services. When I reached out to vaccine experts to discuss whether my dystopian concerns were unfounded, they concurred that this bleak outlook is indeed plausible, and it could deteriorate even further. Each day seems to bring more troubling news regarding Kennedy's campaign against vaccines. In recent weeks, he has taken several alarming actions. He abruptly dismissed all 17 members of the CDC's Advisory Committee on Immunization Practices, ACIP, and replaced them with largely inexperienced individuals, some of whom are openly anti-vaccine activists. This new committee quickly voted to eliminate thimerosal, a rare but safe preservative, from flu vaccines. Additionally, he altered CDC guidelines to no longer recommend COVID-19 vaccinations for healthy children and pregnant individuals. Furthermore, he announced that the U.S. would cease funding Gavi, an international organization dedicated to vaccinating children globally. Peter Hotez, dean of the National School of Tropical Medicine at Baylor College of Medicine, expressed his concerns, stating, "It's hard to know how this is all going to play out, but right now everything appears very dark. I don't think we've hit bottom. I think he's continuing to chip away with some pretty big chips to erode our vaccine ecosystem. I don't see a turnaround at this point. We're still in free fall as far as I'm concerned. I am not the first to attempt to predict the future of vaccines in America." During Kennedy's confirmation hearing in January 2025, Senator Elizabeth Warren outlined the potential actions he could take as secretary. Given his history of profiting from lawsuits against vaccine manufacturers, he could publish his anti-vaccine conspiracies on U.S. government letterhead, which might impress a jury. He could appoint individuals to the CDC vaccine panel who share his anti-vaccine beliefs, allowing them to carry out his agenda. He could instruct the CDC vaccine panel to remove specific vaccines from the vaccination schedule. He could eliminate vaccines from special compensation programs, exposing manufacturers to mass torts. He could broaden the list of injuries eligible for compensation, even without causal evidence. He could modify vaccine court processes to facilitate frivolous lawsuits. He could share FDA data with his associates at law firms, enabling them to exploit it for their benefit. He could alter vaccine labeling and information rules, as well as change which claims are compensated in the Vaccine Injury Compensation Program. Warren concluded, "Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in." Indeed, some of these actions have already materialized. In a recent video, Kennedy announced that the CDC was revising its COVID vaccine recommendations, changing the childhood guideline from should to may, and introducing the concept of shared clinical decision-making. While completely removing the recommendation for pregnant individuals, who are at a significantly higher risk for severe illness and death. I posed the question to experts. Could other vaccine recommendations be similarly weakened? Paul Offit, a professor of pediatrics at the University of Pennsylvania Perelman School of Medicine, responded, I think it's a real possibility. I think in many ways it's a goal. Project 2025, the right-wing blueprint for the second Trump administration, specifically called for eliminating the CDC as a recommending body. If a vaccine is no longer recommended, that means it couldn't be required for school entry, a long-standing target of anti-vaccine activists. Others believe the situation could be even more dire. Dorrit Rice, a professor at UC Hastings College of Law, stated, Kennedy's end goal is to remove most or all childhood vaccines, to make them inaccessible. In my view, your scenario is plausible, although you're being very cautious in saying they might move to shared clinical decision-making. They could simply declare, this is no longer recommended. The new ACIP advisors could entirely stop recommending certain vaccines, such as HPV, influenza, and hepatitis B, all of which have been targeted by anti-vaccine activists. They could also vote to eliminate the Vaccines for Children program, which allocates $5 billion for vaccinating nearly half of all children in the United States. The administration may also complicate the approval process for new vaccines. Hotez noted, it's not only about Kennedy's insistence on saline placebos, referring to the health secretary's announcement that vaccines would need to undergo new, unethical clinical trials involving placebo tests. There's so little vaccine expertise now, either at the FDA because people seem to be leaving, and with ACIP there's almost no vaccine expertise in its current group. Moreover, the public advocacy against vaccines by figures like Kennedy poses significant harm. This includes the recent recommendation by ACIP advisors to eliminate thimerosal, a preservative used only in multidose vials of flu vaccines, representing about 4% of all flu vaccines administered in the U.S., to prevent bacterial and fungal infections. Thimerosal was removed from all other childhood vaccines in 2001 as a precaution when anti-vaccine activists began linking it to autism, a connection that has been disproven by multiple studies. A complete ban on thimerosal could undermine public confidence in the safety and necessity of vaccines. In June, the Department of Health and Human Services awarded $150,000 to the Arizona law firm Bruckner Spittler Schultz for its legal expertise regarding the National Vaccine Injury Compensation Program, which is overseen by the Health Resources and Services Administration, a subagency of HHS. Drew Downing, a lawyer at the firm, is known for representing individuals claiming vaccine-related injuries and has been involved in lawsuits against vaccine manufacturers. Several new ACIP advisors have also served as expert witnesses in lawsuits against pharmaceutical companies. Offit remarked, I think Kennedy's goal is to either remove vaccines from the Vaccine Injury Compensation Program or add to the list of compensable injuries, all of which will weaken the vaccine infrastructure. For instance, autism could be added to the list of injuries based on the administration's expedited research to find a link between the condition and vaccines, despite decades of scientific evidence to the contrary. Changes to the compensation program could lead vaccine manufacturers to withdraw their products from the U.S. market, as Offit explained, make vaccines expensive enough, or make them more susceptible to frivolous litigation, and they'll leave. A similar situation has occurred in the past. In 1980, there were 18 companies producing vaccines. By 1990, that number had dwindled to just 4. A 1981 study suggested that the whole cell pertussis component of the DTP vaccine could, in rare cases, cause permanent brain swelling. Subsequent research disproved this link, revealing that the swelling was actually caused by infant epilepsy. Nevertheless, litigation against pertussis vaccine manufacturers and subsequently all vaccine producers began to escalate, resulting in skyrocketing vaccine prices and driving some manufacturers out of business. In response to the unstable vaccine market, Congress enacted a law in 1986 that led to the establishment of the National Vaccine Injury Compensation Program. Offit stated, if you really want to hurt vaccines, mess with the Vaccination Compensation Program. He emphasized that vaccines are not typically a lucrative venture for pharmaceutical companies. They profit from products that are administered frequently. They don't earn as much from those given once or a few times in a lifetime. While the vaccine market is substantial for pharmaceutical companies, vaccines are still a very modest component of their revenue compared to all the small molecule drugs that they're producing, Hotez explained. If faced with litigation, companies might conclude that vaccine production is not worth the risk. If it becomes untenable for them to remain in the U.S. market, they may just pull the plug on their vaccine side altogether. According to a recent study, if the measles vaccination rate drops by just 10%, an estimated 11.1 million people will contract measles over the next 25 years. Other vaccine-preventable diseases would also resurge, leading to devastating illnesses and fatalities. However, this is not merely a future concern. Outbreaks are already occurring. The year 2025 has been one of the worst for measles in decades, with whooping cough cases increasing six-fold between 2023 and 2024, and polio being detected in wastewater in 2022. Hotez remarked, "Things are already starting to fray. Measles is the first one you see break through because it's so highly contagious, but the others will follow. I worry about pertussis. I worry about the return of diseases like HIV meningitis, which I dealt with as a pediatric resident. And I even worry about polio making a comeback." Yet, outbreaks often highlight the critical importance of vaccines, increasing public demand for them. Rice noted, "As outbreaks grow, we will see people clamoring for vaccines. Remember that most people still vaccinate their children. A recent poll revealed that 91% of parents believe vaccines are safe for most children." Offit expressed optimism, stating, "People want to vaccinate their children. I believe we won't reach a point where vaccination rates drop low enough to trigger widespread outbreaks. We won't let it get that far. I have to believe the federal government will step in." Hotez concurred, asserting, "Ultimately, it's going to come down to the White House." Outbreaks, however, will not be solely attributed to top officials like Kennedy, Rice pointed out. Outbreaks are not going to be limited to the Kennedy outbreaks or the HHS outbreaks. They're going to be the Trump outbreaks. I don't know how much Trump is willing to give Kennedy leeway when polio or diphtheria starts making a return. Regardless of the future, significant damage has already been inflicted, and Kennedy has only been in office for less than 5 months. Rice stated, "It will take decades, not years, to repair the damage. Kennedy and other officials have essentially taken a machete to our public health institutions, and restoring trust will take time. Unfortunately, there are no indications that the damage is subsiding or that relief is on the horizon. We're in trouble." 2. RFK Jr.'s Gavi decision. How withdrawing funding puts millions of children at risk. The stakes are incredibly high when it comes to children's health, and Robert F. Kennedy Jr.'s recent actions seem dangerously reckless. His appointment as Secretary of Health and Human Services immediately raised alarms because of his long-standing history of endorsing vaccine-related conspiracy theories. But here's where it gets controversial. His latest move to pull U.S. funding from the Global Alliance for Vaccines and Immunization, Gavi, could potentially cost far more young lives worldwide than any of his previous efforts to alter immunization policies in the U.S. To understand why this decision is so alarming, it helps to know what Gavi represents. Founded in 2000 through a collaborative effort involving the U.S. and UK governments alongside various philanthropic organizations, Gavi's mission has been to expand access to life-saving vaccines for children in low-income countries, especially those in the global south. While it might not have been flawless, critics have noted missed opportunities during the COVID-19 crisis. Gavi stands out as one of the most effective and inspiring examples of international cooperation in recent decades. Its impact is measurable and profound. A study published in the British Medical Journal found that Gavi's support for vaccination programs around the globe has led to a reduction in infant mortality by over 9% and a 12% decrease in deaths among children under 5. These are not just statistics. These are lives saved every year through routine immunizations. During the COVID-19 pandemic, Gavi played a pivotal role in establishing and managing COVAX, a global initiative aimed at distributing vaccines equitably to poorer nations. Though the rollout was slower than hoped, COVAX eventually delivered around 2 billion vaccine doses worldwide, preventing hundreds of thousands, perhaps even millions, of deaths. Initially, wealthier countries hoarded vaccines far beyond their immediate needs. Canada, for example, had secured 154 million doses for a population of just 40 million by late 2020, while many poorer nations had no access at all. Gavi, through COVAX, helped address this glaring global imbalance. Kennedy's choice to cut off funding to one of America's few positive global health initiatives is not just misguided. It's potentially catastrophic. This move risks fueling resentment over health inequities worldwide and could seriously damage the U.S.'s international reputation, especially when compared to countries like China that continue to invest in global health partnerships. His apparent willingness to prioritize conspiracy theories and isolationist views over science and global cooperation is a grave error that will cost children their lives. The consequences won't stop abroad, either. Americans themselves stand to suffer because no country can fully shield itself from health threats in an interconnected world. A lesson vividly underscored by the pandemic. Furthermore, Gavi is built on market principles, including respect for intellectual property rights, which benefits U.S. companies and consumers by encouraging innovation and ensuring a steady pipeline of new vaccines and medicines. Of course, some critics argue that Gavi leans too much in favor of intellectual property holders and vaccine developers, rather than pushing harder for generic manufacturers to bring down costs. Médecins Sans Frontières, for instance, has criticized Gavi for paying patent holders what they consider overly generous licensing fees, which increases the expense of vaccinating children around the world. But this debate highlights a deeper tension. If global norms surrounding intellectual property and payments shift too far away from protecting innovation, we risk losing the incentives that drive new and better medicines. If Kennedy's anti-science stance prevails, the U.S. could face a future where it is less healthy, less respected on the world stage, and economically weaker. Meanwhile, countless children worldwide may never live to reach adulthood because of preventable diseases. So, what do you think? Should the U.S. continue supporting Gavi despite criticisms? Or is it time to rethink the approach to global vaccine funding? Are we willing to risk millions of lives over disputes about intellectual property? This issue invites strong opinions. Feel free to share your thoughts in the comments below. 3. New CDC vaccine panel members' controversial anti-vax past. The recent appointment of a nurse to a pivotal federal vaccine advisory board has raised eyebrows, particularly due to her long-standing belief that vaccines are responsible for her son's autism. This claim has been thoroughly debunked by extensive research and numerous studies that have consistently found no link between vaccines and autism. Vicki Pebsworth, a registered nurse, is one of 8 newly appointed members of the Centers for Disease Control and Prevention's CDC Advisory Committee on Immunization Practices, ACIP. These members were specifically chosen by Robert F. Kennedy, Jr., a prominent vaccine skeptic and former health secretary under Donald Trump. Dr. David Gorski, a professor at Wayne State University and a recognized authority on the anti-vaccine movement, remarked, "She's probably been anti-vax longer than RFK has." In a controversial move, Kennedy dismissed all 17 previous committee members in June, replacing them with individuals who share his views. It's worth noting that Pebsworth and Kennedy likely have a history of collaboration, as their respective organizations have supported each other's initiatives in the past. Seth Nookin, a professor of science journalism at the Massachusetts Institute of Technology, expressed concern over Pebsworth's position on the committee, stating, "If I had a child who I believed had been harmed by whatever, it doesn't have to be vaccines, I wouldn't then trust myself to be on a federal safety commission on that issue." Pebsworth has also been involved in legal actions against COVID-19 vaccine mandates, aligning with Kennedy's agenda. In a declaration to a federal court, she claimed that the increasing number of vaccines recommended by the CDC might be linked to rising rates of chronic illnesses. This assertion is based on a discredited study that has been a staple argument among anti-vaccine activists. Nookin, who authored The Panic Virus, A True Story of Medicine, Science, and Fear, described the National Vaccine Information Center, where Pebsworth has served as volunteer research director since 2006, as a foundational organization in the modern anti-vaccine movement in the United States. Originally founded in Virginia in 1982 as Dissatisfied Parents Together, the group rebranded in 1995 and has since received significant funding from controversial figures like Dr. Joseph Mercola, who has been labeled as a major spreader of misinformation regarding COVID-19. Despite her controversial views, Pepsworth holds medical credentials, including a doctorate in nursing, and has experience teaching research courses at the college level. She has been vocal about her belief that her son, Sam, suffered harm from the measles, mumps, and rubella MMR vaccine, a claim that contradicts the overwhelming evidence disproving any connection between vaccines and autism. As early as 2001, Pepsworth organized conferences promoting alternative treatments for autism, including one in Michigan featuring Andrew Wakefield, the discredited doctor whose 1998 paper falsely linked the MMR vaccine to autism. She has publicly stated that she placed her son on a restrictive diet and administered chelation therapy, a treatment intended for heavy metal poisoning, neither of which has been proven effective for autism. Gorski noted that during the late 1990s and early 2000s, the anti-vaccine movement had two main factions. One in the UK, led by Wakefield's fraudulent research, and another in the US, which focused on the dangers of thimerosal, a mercury-based preservative used in some vaccines. Despite thimerasal's long-established safety, it has been a focal point of misinformation for years. A significant turning point for the anti-vaccine movement occurred in 2015 when a major measles outbreak at Disneyland in California led to stricter vaccine requirements for schools. This incident galvanized parents and provided a platform for anti-vaccine groups to voice their concerns. Gorski observed that while the anti-vaccine sentiment used to span the political spectrum, it has increasingly become associated with right-wing ideology. In 2017, Pepsworth testified against a school mandate for a meningitis vaccine in Virginia. As the nation awaited a COVID-19 vaccine in 2020, she cautioned that unknown consequences could arise from the vaccines. In 2021, she testified against COVID-19 vaccines before the University of Hawaii's Board of Regents. In her public testimonies, Pepsworth often identifies herself as both the volunteer research director for the National Vaccine Information Center and as the mother of a child injured by his 15-month well baby shots in 1998. Experts in state vaccine law have noted that groups like Pepsworth's have recognized that most vaccine policy is determined at the state level. They have developed model legislation to encourage supporters to advocate for their cause, although they have struggled to achieve significant victories, such as eliminating vaccine mandates in schools. Despite the vocal opposition from a minority, public support for vaccine requirements remains strong, although it has slightly decreased since the pandemic. Legislators are aware that they are hearing from a passionate minority, while the majority still understands the necessity of these laws. In 2017, Trump considered whether this vocal anti-vaccine group could be part of his political coalition. Just days before Pepsworth's appointment to ACIP, she and the founder of the National Vaccine Information Center publicly opposed COVID-19 vaccines, arguing that the FDA should not recommend mRNA COVID-19 shots until sufficient scientific evidence demonstrates their safety and effectiveness for all populations. Over 270 million Americans have received COVID-19 vaccines, with the federal government closely monitoring any rare adverse events. During the first meeting of Kennedy's newly formed ACIP panel, thimerosal was a major topic of discussion. The committee heard a presentation against thimerosal from Lynn Redwood, a former president of the World Mercury Project, which has since evolved into Kennedy's anti-vaccine organization, Children's Health Defense. Notably, a report on thimerosal's safety prepared by CDC scientists was removed from the meeting agenda by Kennedy's office. Ultimately, the committee made a surprising recommendation against seasonal influenza vaccines that contain thimerosal, a decision that shocked many in the medical and scientific communities. Pepsworth abstained from voting, expressing a desire to vote separately on the recommendation for influenza vaccines. She did not respond to inquiries about how she would have voted on the flu shots if given the opportunity. 4. RFK Jr.'s Gavi funding cut. The controversial vaccine study behind the decision. A single disputed vaccine study has sparked global health turmoil, and experts warn its controversial use in policy decisions could cost children's lives. Here's why the medical community is sounding alarms after Robert F. Kennedy Jr. cited this research to justify slashing U.S. funding for Gavi, the vaccine alliance that immunizes children in low-income countries. The Firestorm centers on a 2017 study examining the DTP vaccine, which protects against diphtheria, tetanus, and pertussis. Kennedy called it a landmark proving the vaccine's dangers, specifically quoting co-author Christine Stubble-Ben's claim that vaccinated children in 1980s Guinea-Bissau faced 5 times higher risk of dying than unvaccinated peers. But here's where it gets contentious. Leading vaccinologists argue this research is fundamentally flawed. Beat Campman of the London School of Hygiene and Tropical Medicine dismantles it point by point: dodgy statistics, outdated 40-year-old data, and irrelevance since modern DTP formulations bear no resemblance to 1980s versions. Even the original researchers later published contradicting findings. This raises a critical question. Should one disputed paper override decades of evidence? The World Health Organization's independent panels have repeatedly validated DTP safety over 20 years of review. Kate O'Brien, WHO's top vaccine expert, emphasizes that billions have safely received this over 50-year-old vaccine. Warning withdrawal would cause direct harm. It will result in deaths. Yet Kennedy's decision stands, defying global consensus and cutting over $1 billion from Gavi. Paul Offit of Children's Hospital of Philadelphia calls this a travesty, noting Gavi's unparalleled efficiency in saving lives. The real controversy? Policymakers leveraging contested science to justify cuts while children's futures hang in the balance. Where do you stand? Should singular studies dictate global health funding when overwhelming consensus disagrees? Share your perspective below.